Is This Normal, Doc? A podcast sponsored by Tanner Clinic.
Welcome back to our second part on vaccines. This is part 2 of the mini-series, so if you missed part 1, I recommend going back and watching that. We go over all the basic vaccine questions, and we laid a really good foundation on some vaccine questions that we're going to cover today. We are back with the same crew. We have Dr. Hutchinson, and I just wanted to point out that we took so long to film part 2 that he grew a beard in the meantime, so...
Kind of. 2 weeks into a scraggly beard, we're officially at the awkward stage.
If you're listening, you obviously didn't know that, but I'm just letting you know that he has a beard now. It's like short, but it is there. And so that's just how on top of it we've been with this. But we just got to work around everybody's schedules, and we do it when we do it. So let's get right into it. I think we got a lot to cover today. So first things first, we're going to get into the really nitty-gritty topic, which is like some controversies and some myths. The first question I think a lot of people are interested in, especially right now, especially in the wake of the COVID-19 pandemic, is the COVID-19 vaccine safe for kids?
So officially, the COVID-19 vaccine has been pulled for children. So it's no longer offered or recommended to be offered from the government's point of view, like the CDC, the HHS, that kind of thing. Pediatricians will still offer it, at least in some clinics, I believe. The American Academy of Pediatrics still recommends that children be vaccinated with the COVID-19 vaccine. That's the official take, I guess you could say. That's, I think, really a kind of a personal decision. COVID-19 used to be much worse when we had the original strain. We had the Delta strain. We had the Omicron strain. You know, those were pretty nasty viruses and makes people pretty sick. Fortunately, we're not as bad now. Like the COVID-19 is mutated, and typically when a virus mutates, it becomes a little more infectious, like easily spread, but less severe. And which is definitely what's happened now, because, you know, we don't see people dying of COVID still. You know, some elderly people died. That's not an uncommon thing. We get common viruses that end up putting elderly people in the hospital, and they have complications related to that. But for kids and for healthy adults, you know, it's miserable. It's really, really annoying, but it's not nearly as severe. So I think a lot of... What's that?
You just have COVID?
I had COVID a week and a half ago. Yep. And I can tell you it was unpleasant. It was one of the reasons why we're doing the second portion now and not last week.
And the reason
it's one of the reasons why I have a beard, because I didn't shave for a while, because I'm like, I kind of already got a beard. We'll keep that. But yeah, so it's miserable. But you know, if you're healthy, you typically pull through. And whether or not you want to, you know, be vaccinated against that, that's a personal decision, just like all vaccines, you know, are kind of a personal decision. But if you've got some immune suppression issues, or you're, you know, frequently in contact with somebody who can become really, really sick from the COVID itself, then you might consider being vaccinated, weigh the pros and cons, and make a decision. I still think the general consensus, scientifically wise, is that it is safe. If you have some reservations or whatnot and you really don't want to do it, I don't think it doesn't break my heart. I can tell you that.
Another big question I think a lot of people have is, can I get the COVID vaccine with other vaccines? And also, are combination vaccines safe? You know? So combining vaccines, I think, is a question that a lot of people have. Is that safe?
Yeah, you can get the COVID vaccine with other vaccines if you want to. Combination vaccines are definitely safe. To be completely honest, COVID vaccine is not super popular right now, and I don't remember the last time we gave a COVID vaccine. It's been months. Mm-hmm. But you can definitely get it with other regular childhood vaccinations. That's fine. So there's a lot of concern from lots of parents that, you know, we give a lot of vaccines at the same time, and maybe this is dangerous. Combination vaccines are a great solution to that. The things that typically concern people regarding vaccines are not so much the antigens that we use to vaccinate against. So antigens are the things that the disease, the virus, the bacteria or whatnot makes that you produce immunity to. So we give you this certain combination of molecules and your body says, okay, this is foreign, and it makes antibodies against that. So if it sees it again, the antibodies are already prepped to attack that certain foreign antigen. But typically the things that people are concerned about are the adjuvants, the things that are in the vaccines that help mount an immune response. So that cause a little bit of inflammation and that calls up your immune system. You can have multiple antigens in a vaccine, but really a smaller amount of adjuvants that cause that immune response. And you'll react to those antigens and make antibodies against multiple different diseases and only have to have that one exposure to the adjuvant to cause the immune response, which is typically what causes people to be sore or achy or have a little bit of a fever.
Yeah.
So combination vaccines are great in that regard. Plus, it's less pokes. So you give a kid, a couple of vaccines that have multiple different antigens in those vaccines. It's only 2 pokes as opposed to, 8 if we were to do them all separately.
Yeah.
So all combination vaccines are tested with the same scrutiny that any other vaccine was. They have to be proven to be safe. They have to be proven to be effective. And for a convenience sense, they're great in that regard.
I don't know. I feel like this episode is kind of like controversial.
There's a lot of questions, a lot of misinformation, and lots of very strong opinions on all over the place. That's okay. Little controversy is okay.
Yeah. I was going to ask you, I have heard of pediatricians kind of letting go of patients who don't vaccinate.
Because they don't vaccinate?
Because they don't vaccinate. So what are your thoughts on that?
I guess I can only really speak for myself in this regard because every pediatrician, every clinic and office might be a little bit different. We vaccinate, and we vaccinate with the CDC schedule because that is the safest thing that we know. And we vaccinate against some really serious diseases that can cause permanent repercussions and death, those kind of things. But I've always been a really big advocate for parental rights. Parents get to decide how they raise their kids, and healthcare is a big part of that. If they know that, we vaccinate against these horrible diseases, and if we decide not to vaccinate, that puts us at a higher risk. If they understand that, but they still are uncomfortable for whatever reason, then that's their decision to make. It's my job, so I'll be the doctor and you be the parent. I always recommend vaccines. I recommend them by the CDC schedule. Again, that's because that's the safest thing that we know. And if you have reservations or whatnot, we can discuss that. I don't kick anybody out of my practice because they're not comfortable with vaccines. In the end, we all just want the kids to be as healthy and as safe and live full lives and be happy. That's what we all want. And that's what the parents want. And they have the reservations that they have, that's their decision. So in the end, as long as they understand pros and cons, then that is what we call informed consent, and the parents have the right to decide that.
I don't remember, was this in the last part where we were talking about getting to know your pediatrician is so important, and having a good relationship with your pediatrician? I feel like if you don't feel comfortable with your pediatrician or don't I would maybe recommend finding someone that you feel comfortable with and get to know.
That's the way any kind of relationship is. Some people click with other people better than others. That's just a normal thing. And you should click with your pediatrician. Your kids should click with your pediatrician. But
I feel also if you know your pediatrician, you might be more inclined to I don't know,
ask questions and listen. Ask questions,
and not be afraid to ask questions.
Yeah,
absolutely.
And that's the most important part, I think, is not being afraid to really put your concerns forward and really discuss them with your pediatrician. Because I think you guys really
or any doctor
would be down.
You should always ask your doctor the questions that you have. Yeah. You should have a relationship.
And not feel embarrassed either. And I mean, that's one of the reasons I wanted to do this podcast, is I felt like people would be more inclined to ask questions that they maybe wouldn't be as comfortable asking in an actual appointment.
Because of that controversy, like you're saying.
Because of,
Or worried that you're going to offend somebody. No.
So I'm glad that we can discuss some of those things, but I think that people assume that doctors aren't okay answering some questions, but I think you'd rather have people ask than not ask.
And I get some really out there questions sometimes, and that's okay. If you really have that question, half of my job is alleviating anxieties, answering questions.
Especially for new parents. They're coming in this blind, so they really don't have any.
There's no owner's manual. Baby doesn't come out with an owner's manual.
No.
I have heard of parents spreading out vaccines, so they're not typically following the schedule because they don't want them so close together. Is that normal?
Okay.
Is that okay?
Yeah. So a lot of parents have the concern that we do lots of vaccines at the same time, and they kind of want to spread that out. The only only downside to that is the schedule that has been produced wasn't an accident. The goal was to vaccinate kids against bad diseases, as quickly as possible, to protect them as quickly as possible. So if we want to spread out vaccines, it just kind of prolongs that period where they may be more susceptible to things like that. It might lead the kids to hate the doctor a little bit more because they end up getting a shot every time they go to the doctor. They don't love coming to see me anyways. I'll tell you that right now. Yeah, in the end, that's fine. We protect against the diseases. And if it's more comfortable for parents to spread them out, then yeah, we don't want to do anything that makes parents uncomfortable.
Are there concerns with doing too many vaccines at once?
You can't like double up on a vaccine. It's not like you're behind on your pertussis vaccine and we need to do 3 of those. So we'll just do all 3 at the same time. Like that doesn't help. That doesn't double up the response that you get. If you're going by the CDC schedule or whatnot, then that's perfectly safe to do all of those recommended vaccines at the same time. Trying to catch up, I don't really know of anybody that would want to do more than, a few vaccines at the same time anyways. Yeah. So long story short, you can get a handful of vaccines at the same time and they're safe. Ask your doctor. I hesitate to say, oh yeah, it's perfectly safe and that's fine. But because technically there would be some occasions where maybe we could get too many vaccines at the same time. I don't know of anybody that would do that or that have, but ask your doctor about that.
I'm in a new moms Facebook group, and vaccines is always a big topic in it. And one lady was like, oh, I don't think I'm going to give my kid any vaccines until they go to school and then give them all. And I'm like, that seems like that would overflood their system.
So that's a great example. So as you get older, the recommendations for vaccines change a little bit. Yeah. If we're going to school when we're 5, we start kindergarten when we're 5, then there's 5 years of, risk for disease that you really don't want to get. There is going to need to be a little bit of catch-up period. So yeah, they couldn't, you couldn't come in that day and then get caught up on vaccines. Yeah. It's going to take a while. And the reason for that is we give you a vaccine, we vaccinate against whatever, pertussis, and your body mounts an immune response. And then some of that immunity kind of wanes a little bit as they get a little bit older because they don't see the disease. So we remind them. That's what the booster is. Okay. And so when we remind the body enough, we remind your immune system enough, it will maintain immunity against that, hopefully lifelong or pretty close.
So we know there's a lot of misconceptions as far as vaccines go. So we want to do kind of a rapid fire of common misconceptions that we hear. Okay. Are you ready?
Yeah, let's do it.
Okay.
Can vaccines cause autism?
All right. So that's a fantastic question. The short answer is no. And the long answer is no, too. But I can give you the
just
whole
clarifying all bases.
Yeah.
It's just no all around.
So there was a paper that came out, I think in Nature, one of the really renowned scientific journals in the late 90s that said the MMR vaccine linked to autism. They had 12 patients that they studied, and they said that there was increased risk to autism for that vaccine. And so, of course, that caused a big stir in medical community, science community, and whatnot. Lots and lots of papers have come out. Lots of people did research, and they should, because that is a very scary thing that proved that no, the vaccines don't cause autism. The paper was officially pulled. It was by a doctor named Andrew Wakefield. It's come out, all of the issues that were with the paper, that, some of the kids had symptoms of autism before MMR was given. Some of the kids were never actually officially diagnosed with autism. And there's only 12 patients. And that's a really small number to determine a causative agent. He got lots of scrutiny. He doesn't really practice medicine anymore. He goes around and tours and makes money from giving lectures or that kind of thing. But if you look him up, he'll still absolutely adamantly claim that there's a link and whatnot. So that was kind of the birth of the autism question. And that was the birth of lots of the vaccine hesitancy that we've had. So no, it doesn't cause autism. We've kind of gone through that, and I totally understand the anxiety that parents have. My oldest son is autistic, and he's a great kid. There's things that he deals with that other kids don't have to deal with, and autism is a really, really scary thing, especially nowadays, because the rate of diagnosis for autism has increased substantially. And that's another thing too that people worry about. So we talk about the rise in autism, how many kids are getting autism now than there were before. So much more autism. And a lot of that has to do with, we diagnose autism now a lot more frequently because we screen for it significantly more than we were, a couple decades before.
That's what I was going to ask. I feel like when medical technology advances, then there are more diagnoses of certain things because we just know different signs.
Right. And we understand autism lots better than we did, and we can get kids services and whatnot. And so pediatricians are much more apt. If this kid, my patient, has these issues and a diagnosis of autism helps them get services, then we're going to do what we need to do. If an appropriate diagnosis of autism is, if that's correct, then we need to get that diagnosis and we need to get the kids into services. Statistically, I think the jury is still out of, this increase in diagnosis of autism. Is it more autism or is it just more diagnosis? I think, generally speaking, and this is another controversial thing, but I think technically both of those have increased.
Okay.
I mean, definitely the diagnosis of autism has increased many, many times fold. There may be still an increase of actual people having autism as opposed to when it was a few decades before. Not caused by the vaccines, and that's something that people are still researching very diligently to figure out why, if we're having more autism, if it's really occurring more, why. Yeah, that's the answer for that.
One of the common misconceptions is if other kids are vaccinated, does mine need to be vaccinated? And that natural immunity is better than vaccine immunity.
Technically, that first statement would be correct. If your kid was the only single kid that was not vaccinated, the odds of them, contracting the diseases that they're not vaccinated against would be very low. Unfortunately, that is not the world that we live in. There are many, many kids that are unvaccinated. And some of the kids can't get vaccinated. I had a patient who came down with a really severe case of what's called IgP. Their platelet counts just dropped. They had an autoimmune response that it chewed up all their platelets, and they
had to do a treatment called IVIG, which gets a whole load of antibodies in your body that take out those bad antibodies. But now the kid can't be vaccinated for 6 to 12 months or so, because if we vaccinate against it, the vaccines won't work because it's got all these other antibodies that are kind of, taking things out. And that's just one case. Other kids have lymphoma or other autoimmune issues or allergic. They're allergic to the vaccines. For whatever reason, they can't be vaccinated. One of the ways that we protect those kids is that, everybody else that can be vaccinated is vaccinated. The odds of diseases being present in the community go down so low that it's statistically not going to happen. With the increase of vaccine anxieties and whatnot, those are not the only kids that are not vaccinated. Now we have many, many kids that are unvaccinated. Utah and Idaho are the number 1 and number 2 states for vaccine exemptions in the country. And that's particularly complicating for especially the younger grades, because as we go on, there's more and more exemptions and more kids that aren't vaccinated. And we get a whole group of kids that aren't vaccinated together. The risk of one of them having the disease or any disease goes way up. And then the risk of them spreading goes exponentially up. So if we had a kid come from Disneyland who happened to walk by a kid from India who has the measles or has polio or whatnot, contracts that disease, brings it back, if everybody's vaccinated, he's not going to spread that disease. The problem is we have those lower vaccination rates. So the odds of him spreading it to someone and then that kid going home and spreading it to someone else and then that kid spreading it to daycare or whatnot, that contagion increases significantly. The simple answer to that is if your kid was the only kid that wasn't vaccinated, they would be very, very low risk.
It's that herd immunity, right?
Yes, exactly. As far as it's better to contract the disease and become immune to that.
More what it is.
So to some degree, there's some truth. If you were to get, say, the chicken pox,
that's the one that really came to my mind.
Yeah, you're really immune to the chicken pox after that. If you get the chicken pox vaccine, you're still very immune to it, but maybe not quite as strongly as if you got the real disease. And that's fine as long as you don't get the chicken pox and then you get cerebritis and then you wind up in the hospital with major brain swelling. And that's not a common thing, but that's still a thing. So then you might be immune to it, really immune to chickenpox, but now you're disabled or whatnot.
And then shingles. You can only get shingles if you've had the chickenpox, right? So if you never get the chickenpox, can you still get shingles?
If you never get the chickenpox and you're up to date with vaccines, then you're typically not going to get the shingles. We never say never, because there's always a possibility that you didn't react very well to the vaccine or your immunity waned so far that you still get it. Yes, shingles is super miserable. And if you've never had chickenpox, your risk of the shingles is way, way lower.
I just have heard of so many like parents, especially like before my time or like even when I was younger, I think parents still did this. Like if your friend got the chicken pox, people would like send their kids over.
It was like a chicken
So-
pox
They'd be like,
party.
"Oh, let's
Yes.
go get
So the
chickenpox
reasoning
for you."
reasoning for that is if you get the chickenpox when you're younger, it tends to be less severe with those more complicating symptoms. So they would send all the little kids over to get it, and we'll get it over with now, kind of thing. But dad, who's never had the chickenpox, has to like check into a hotel and stay away for a week because if he gets it, then he's much higher risk of complicating problems.
Do vaccines contain harmful ingredients?
That's probably the number one question that parents have. If you look at the list of vaccine ingredients and whatnot, there's going to be some wonky stuff that's there. Small doses of those things, those are, again, the adjuvants that cause the immune response, like aluminum is one of them. Proven to be safe at the doses that they're given at. That's another reason why, the combination vaccines are helpful because you only get one dose of that adjuvant in multiple antigens. Proven to be safe and not harmful, but can be concerning or whatnot. So that's the thing that you need to talk with your pediatrician about and come up with a plan, kind of what you want to do. If we want to spread out vaccines, or if we really need to talk about it's okay to get, these 2 vaccines today as per the schedule, and all the vaccines that when we give vaccines, all of the vaccines are tested together. So we don't add a new vaccine without adding it also to the schedule and then testing it in the schedule.
Okay.
So maybe some concerning ingredients, but safe.
Another question that I feel like we kind of covered, but maybe not fully. Do vaccines inject you with the illness or disease?
Again, we talk about the antigens.
Yeah.
So there's kind of 2 different ways to vaccinate. Well, if you include the new mRNA technology, which it looks like the government officially, as of like last week, decided that we're not going to use mRNA technology. The Secretary of Health and Human Services decided that we're not doing any vaccines with that or researching any more vaccines. So that might still be in a little bit of limbo right there. So excluding that, there's kind of 2 other different main methods that we vaccinate with. You can take certain parts of the virus or bacteria, those antigens, and kind of link them with other proteins or whatnot that the body can take up and process to form immunity. Mm-hmm. So there's portions of that disease, or you can have like a live attenuated disease. And there's a couple of vaccines. So they're viruses that have been altered in a way so they can't replicate or whatnot. They're significantly weakened. So it gives your body the upper hand to fight that off. And then you don't actually develop the disease in a way that is injecting that disease, but not causing the disease. A lot of people will have an immune response and think that they're, sick after a vaccine. It's common to have a little bit of a fever. It's common to be a little achy or whatnot. That's your body thinking that it's sick, which is exactly what we want it to do.
I hear that so much. The people say, I get the
flu after I got the flu vaccine. Yes, exactly. Yeah. So you don't get the flu. You have a couple of symptoms of the flu, and that's really unpleasant. Nobody likes feeling like you have the flu, but usually that lasts for a day, maybe 2 days, and you don't become actually infected with the flu and actually sick. So it's common to have those symptoms, but you don't get the actual disease because we don't inject you with the actual disease.
Yeah. As far as like live vaccines go, the only one that I'm aware of is the flu, the mist.
The MMR is live attenuated, and I believe the varicella is as well.
Okay.
Yeah, the chickenpox.
Just curious about that.
So, and if you get the chickenpox vaccine, you might get, a couple of spots of what look like chickenpox at the location that you got injected. That's pretty uncommon, but still we see it every once in a while. And that's because the virus is present and technically infecting a little bit of the cells that are right there. It doesn't have the ability to really replicate and then spread, which is why you don't get it all over. But yeah, that's one of the
really
reasons.
Interesting. I didn't even know that. So I know we've talked a little bit about this, but I know it is a big cause for parental anxiety, and that is what sort of symptoms can occur after a child gets a vaccine.
Right. So it's going to be sore where they got a shot. Don't want to baby that or anything. If you get the shot, it gets a little bit sore. Massage it, move it around. A little bit of achiness, a little bit of a fever or whatnot is pretty common.
Would you say that there's any symptoms that you should be concerned about?
I mean, if anything outside of that occurs and you're worried, then I would say call your doctor and we'll just talk about, what's going on. I had a kid get vaccinated and then was swimming the day before and the day of and whatnot. They got the vaccines, went back to swimming, and they just got horrible swimmer's ear. But the mother was concerned that it was caused by the vaccines, and so we got this ear drainage, and she was panicky. So she called me, and we were able to talk about, well, I think you just need to come in because it looked great the day that we saw you, but maybe we got something else going on. And yes, it was swimmer's ear. We give them medicine for that. So anything outside of, I think, those typical expected reactions, I would say just call your doctor and make sure.
Yeah.
And you should never be hesitant to do that. Like, don't be concerned. We get calls from parents all the time, and that's the way it should be. Like, if you're worried about whatever and you're not really sure this is normal and you're a little concerned, just call or swing by. We'll see them. We'll make sure everything's still okay.
Once again, just having that relationship with your pediatrician, not being afraid to ask questions, especially if you are concerned, I think is really big.
And to feel comfortable calling in.
Anytime.
Yeah.
Anytime. That's what we're there for.
Are there any things that parents can do to help prepare their kids for vaccines?
The thing that I've found, I think, is most helpful is just to be 100% honest with what is going on. Some parents really don't want to tell their kids that they're getting shots when they go to the doctor, and parents know their kids best. So if really not telling them until they get there means, not having panic for the hour, driving to and being in the waiting room, and your kids best and do what you think is best. But I think being upfront and honest as much as you can be is the most helpful. Kids know that shots hurt. So trying to tell them that it's not going to hurt is a lie and not helpful. Just kind of supporting them. It's going to hurt, but it's only going to hurt for a second, and then you're going to be okay, and then we're going to go to the park or something like that.
Yeah.
Just don't undermine it too much because nobody likes getting shots. Nobody likes shots, especially the kids. Being honest and forthright. And by the time the kids are like 18 months old, the majority of their shots are already done. So we get them again when you're like 5, and then you get them when you're 11. By the time kids are that age, they already know. There's no point in saying the shots don't really hurt because they already know.
Yeah. I think of like people like posting videos of their dogs, and they're like, "Oh, you want to go for a walk?" And then they take them to the vet. And I'm like,
I do think like being honest is helpful, and being like, yeah, it will hurt a little bit, but it'll just be a second, and then
you'll be okay, and then we'll eat some ice cream.
Being upfront and honest with them.
Yeah.
But I know every kid is different. Like, especially when I was a receptionist, we had a kid in there for like over an hour one time, and he was older. And I think sometimes they get in their own heads about it. And
my son is that way.
Yeah.
My son just got his last series of vaccines a week ago, and he's autistic, and he doesn't love vaccines. And so can we wait and just kind of breathe? I said, no, we'll just do it. Just do it real quick and we'll be done. And it's bang, bang, and we're done. And okay. All right. We're okay.
I was definitely the kid that like the longer I would sit in the waiting room, the more nervous I would get.
Yeah.
And so some parents don't want to tell their kids they're getting vaccines until that moment to avoid that. And I understand that to an extent. Yeah.
Yeah. Yeah, my mom never tried to sugarcoat it, though. She's like, this is happening, whether you like it or not.
I don't remember being afraid of them, really. I mean, I probably had like anxiety. I was a very quiet, anxious kid, and I would just sit there in my anxiety. But I wouldn't ever fight it. But I don't remember ever being like super terrified of them.
Well, now as an adult, it just is one of those things.
Still don't love
it, but it is what it is, unfortunately.
So that is the conclusion of our 2-part mini-series on vaccines. I hope you learned a lot. And one of the biggest takeaways I think that I got from this episode or this series was to form that relationship with your pediatrician and be able to ask them those questions. Because there is a lot of anxiety with things that, especially with all the information that we have available to us, that it's just really good to have that relationship with your doctor, be comfortable asking them questions about things that you are maybe concerned about or worried about. So I recommend that. Dr. Hutchinson is a great pediatrician. So if you're looking for a pediatrician, he's in our Layton A building, and I'm sure he'd be glad to see you. And he's great with answering any of your concerns and questions
you have, I'll do my best.
I used to work for him, so I know that that's true. Like, I really do. So if you want to keep following us along on our Is This Normal Doc journey, make sure to follow us on our Tanner Clinic social media, and you can follow along. See you later.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider.